Howdy YouTube family, it's Bolt CRNA coming to you again with another day's topic. So I was asked to do a video about why people fail out of CRNA school and how you can avoid failing out of CRNA school. So this is kind of a little bit more of a somber topic, and I do have some friends who actually failed out of CRNA school. So I can talk to you guys a little bit about what obstacles you can expect to face in CRNA school and how you can try and dodge those issues and hopefully start the journey and finish the journey. So let's get into it. The number one issue that I've seen from students who do not pass CRNA school is time commitment and time management. That is a huge part of starting this journey. Once you get into the CRNA program, you're going to be committing a lot more time and energy to this thing than anything you've ever done before. You will need to be able to prioritize CRNA school to being number one in your life, which means your wife, your kids, whatever job you used to have, your family, your church, your hobbies and free time, all of that stuff is going to come way second. CRNA school comes up here first, and then everything else is a way down here second. So that means you're going to sacrifice everything with them and all these other things in your life. You're going to sacrifice that over and over and over and over again, to the point where after a couple years of being in school, you almost forget those things. Like, hopefully you're not going to forget about your wife and kids, but you're almost going to forget a life where you could be available to do those things, to go golfing, to go hang out with your friends on a normal basis, to go to your kids' dance recital or whatever. You're gonna be in a mode where you understand that that's just not your life anymore, and it won't be your life until after you graduate. And so people who fail out, people who I've known who have failed out, it's because they did not fully grasp that concept, or they just were not willing to truly sacrifice those things. And if you're just not willing to sacrifice those things, CRNA school will probably chew you up and spit you out, and you probably won't make it. And it's a sad, harsh reality, because my friends who started the journey, I tried helping and I tried giving advice, and we tried, adjustments and things like that. But there just comes a moment where you just truly have to make the decision, like, are you willing to sacrifice all of these things, at least for 3 years, for this one big goal that you're working on? And if the answer is no, then you're not going to make it. And so the answer was no for them, and they withdrew, or was asked to withdraw. So that's your true big obstacle that all of you have to really understand before you step into this thing. And I try and tell you guys that who message me or ask me advice about CRNA school. I hear from some of you in messages and all this stuff that you have this thing going on and this thing and that thing, and I try and warn you, like, hey, you're aware, like, none of that stuff's going to be possible for you to maintain. And it's very cute when a lot of you ask me, like, can I work a job normally when I'm in CRNA school? No, that's not a good question to even ask. Like, that's and to be totally fair to you, I asked the same question before I started CRNA school, because I used to work 50, 60 hours a week. I used to be really good with time management, and when I was in my nursing school, I could work 30, 40 hours a week and maintain a good GPA and good standing with my program and still manage everything. I was busy and a little stressed, but I could do it all. But I figured I could try and maintain that again in CRNA school. No, you're not going to be able to. And if you try, you're probably going to be so burnt out and so bitter and angry that the little couple shifts you're going to be able to work a month that you can squeeze in is not going to make enough money to make it worth it to you. Like, you would have much rather have spent those 1 or 2 days that month that you chose to work a 12-hour shift PRN. You would have much rather taken those days as mental health days and sat with your family and went and had a picnic, or just sat on the couch and stared at the wall for a minute and not had to study and not stress about something for a little bit. Those moments are very important self-care moments in CRNA school, when you have the rare moments that you're not having to just keep going and going and going, and you have a little bit of a break every 2 weeks or so. You have an afternoon that you don't have to do something. So yeah, if you try and like fit in a 12-hour shift in that day and just hammer it all the time, you're gonna burn out. You know, it's not a good call. And if you even, I will say, I do know one CRNA who did work like 1 or 2 shifts a month and throughout their program, and they were just really, really good at time management. They also had a support system, a spouse who helped out a lot, you know, just the right kind of combination of situations that fit together, no kids, no other commitments, you know, and also just like super time management organized and stuff. So anyway, I'm not saying it's impossible for every single person out there to ever work at all, but the reality is you're probably not going to be able to, so don't plan on it. After that, it really comes down to studying. Some of us are better at studying than others, and some of us are better at memorizing things and synthesizing ideas and concepts and critical thinking. And so for CRNA school, you're going to get really good at that, and reading material and text and stuff and forming it into things that are not just things you've memorized, because you'll have to memorize quite a bit of stuff, but more than just memorize things, you have to take it to a next level of learning, which you've never probably had to do before, where you take that memorization of things and then synthesize the concepts into workable ideas and actually ways that you're going to practice and implement that material into your daily practice. So yeah, it's going to make a huge impact on your career and the way you're able to provide anesthesia for your patients. So you can't just memorize material from a book so that then you can dump that material after the test, because you still have to maintain that material, because 3 months later or a year later in clinical, you're going to come into a situation where you probably need to know a portion of that information. And then that doesn't go away. You know, you graduate and you go out into practice, you're still going to need to know that information. So studying is a big important thing too. People usually learn in the first semester of the program what ways they learn best and what ways they study best, and you stick to that method and you use that method all throughout the program. And sometimes it evolves some and shifts some, and you change your method up a little bit, but you definitely have to early on develop a way of knowing at least this one certain way that you study is a way you can really get the information and handle a lot of stuff coming at you at once and be able to use it and be able to score well on the test with that studying method. And the third way that I have known of people who have failed out of CRNA school is through clinical problems. And this can be a gray area, because as an SRNA, sometimes you can be treated unfairly, and sometimes you can be put into situations that are not totally fair to you, and then you can get judged on them. Sometimes you'll have a preceptor who's, you know, over you for the day, who's just not being fair to you and actually almost seeming like they're working against you at times. You really get put into some situations that just, you know, there needs to be some work done on the SRNA training clinically, and how they get treated and talked to and put in, you know, the situations they're put into, and, you know, all that stuff. So I'm just, heads up, you know, you deal with a lot as an SRNA in a clinical setting. But you have to be smart. You have to get really smart and really, quick on your feet, so that you make sure that you're always doing the best thing and the safest thing. And even if somebody's rushing you and talking down to you and putting you in a stressful situation, you have to always be like quadruple checking your drugs and your vials and everything. You know, if people hand you a stick of something, you have to know if, you know, you really need to know, like, is this phenylephrine they've handed me? What are they giving me? You know, all that kind of stuff. That stuff happens easily as an SRNA. You make a mistake clinically, you do something, and you're stressed out in a situation. You're new to a situation. You're new to pediatrics. You're new to cardiac, anesthesia, and you're put into very difficult situations. And part of that is the learning process, and part of that is just sometimes you're put into unfair situations. So I'm just telling you, as a student, as an SRNA, I've seen residents deal with this too. You really just have to have thick skin, and also really, really watch your back and watch every step you're making and everything you're doing, and make sure you never slack up on triple checking everything, making sure all of your supplies are always set up, always being on time, always being as nice and polite as you can be and as teachable as you can be. Even if someone's rude to you or talking down to you, don't talk back. Don't try and defend yourself. Just say a little prayer for whatever's wrong in their personal lives that's making them try and attack you as a student. Point is, do whatever you can clinically to just be under the radar as much as you can. And that can be difficult at times. Trust me, I know. But it's what you got to do. It's what we all do, and it's what you'll have to do if you're going to survive. Students who are visible a lot in clinical and who are notable and seen a lot, they usually don't do as well as the other students who stayed under the radar. So I'll just tell you, you as a student, you want to stay under the radar. And the other thing that kind of ties in with the clinical aspect of things that some students, I don't personally know any students who's had this happen, but it has happened. Drugs, getting involved in substances. That is a huge issue and a definite guarantee you're out of the program. So if you ever have had problems with substance abuse in your past and you're concerned that maybe being exposed to super powerful drugs that anesthesia providers have access to, and you think that might be a temptation for you in any kind of way, please choose a different field. If you want to work in healthcare and you want to do something, choose something else besides anesthesia, because anesthesia, you do have lots of access to very powerful drugs, and statistically 1 out of 10 providers in anesthesia struggle with some kind of substance abuse at some point in their career. It can be career ruining for a lot of people and life ruining, really. So there have been times where students have been caught with propofol or with something else, and you're definitely going to be removed from your program. And then hopefully you're going to find yourself in some rehab and sort out what's going on in your life that's making you do that kind of thing. But yeah, so that's the third thing that I would say is how people fail out of CRNA school is clinically they do something wrong, give a wrong med, or they get stressed out in the moment and do something foolish, or they get rushed, or they're anxious, or they're not prepared and they make a mistake. And it's not hopefully for you, it's not one time you make a mistake and you're out of the program. But if you do that over a few years in the program, you make a couple mistakes, you could be removed. And I do know students who have been all the way up until 2 months before they were about to graduate, were taken out of their programs and told they could not graduate because of something that happened in clinical. So yeah, just be very careful with those kind of things. And then of course the drug abuse and things like that is tied into that as well. So those are the things that you need to be looking out for. Studying, time management and commitment to the program, sacrificing pretty much your whole life for the CRNA program for 3 years, and clinical attitudes and preparations clinically, and substance abuse that you might deal with. So avoid those 3 things. If I have forgot something, which I probably have, comment down below what are ways that people can avoid failing out of CRNA school, obstacles they may face that maybe as an SRNA you've dealt with, or CRNA you remember dealing with, and how you overcame that, so that these people can have good tips and wisdom so that they'll succeed in life if they're trying to go this path. Well, all right, that's Bolt out.